the end result of what we received was something far greater than we could perhaps have perceived we were going to get, because Richard took time to actually understand our business, to understand what we did and what we did for our clients, and actually what was produced at the end was something that not only showed the operation but also the whole culture of the company. In terms of did we get what we expected, we got far more than what we expected, because the whole carrot of Retail Assist is actually present within the DVD.
I've taken it all over Britain and I've taken it to Europe, and people really do like it.
It was an interactive, fun message to launch our sunglass season, which really worked, and all of the feedback was very positive.
It was a success story and I would do it again.
Officers need a wide range of information in order to do their jobs properly. And what mobile data does is it allows them to have access to that information on the street, at incidents, in people's homes, on the motorway. Previously, all they could do was either go back to the station to get that information or ask the control room for the information.
Mobile data is a fantastic opportunity for us because it's going to release an awful lot of time that's spent at police stations by officers back out into the community. So officers are going to be more visible, accessible by the communities. At the same time, they're going to be able to carry out their administration and briefing functions as well.
Can you just switch the ignition off for me? Just bring the keys with you and just join me on the pavement, please. I'll explain to you why we've stopped you. Mobile data increases the efficiency greatly, much so that, scenario of a stop check, for instance, we can speak to the person, point out the offences that they're committing to us.
As we all know, heart attack is a major killer in the United Kingdom, and there's been a huge effort to try and improve treatment of patients who have a heart attack.
When I got to work about 9:30, I had a pain in my chest, which I thought was indigestion, and I had a coffee, and the pain won't go away, and one of my friends at work says, "You've gone grey."
We work very hard with the ambulance service to get patients to where they can be treated best. Currently, that's in a centre where we can provide what's called primary angioplasty. This is where we treat a blockage of the artery, which is the cause of the heart attack, and open it up very quickly, and we can put stents in the artery, which are meshwork tubes to restore blood flow.
They took me straight to the hospital and they found out I had a clot. Then they transferred me to Glenfield, which they did the procedure straight away, which took about 15 minutes, and they removed the clot, and then after that we were fine.
As a practicing family doctor, I've been really pleased to be involved in developing this vision. You've seen some great examples of healthcare in the East Midlands. Now we want the best everywhere throughout the region. But as a family doctor, I want to do much more for my patients. And there is so much more that we can do. Patients deserve and expect much more. The vision is exciting because the future is about putting patients in charge of their own healthcare so they can take care of themselves in a much better way. A member of the public told me recently, aim high, and that excites me. As a clinician, I want to do much more for my patients. This vision is about excellence, quality. Let us all aim high.
Dear Sir or Madam, I'm a teacher in Sycamore Nursery attached to an infant school in the inner city area of Nottingham. The outside area is sadly lacking. We have a wonderful view over the city, but the much exposed tarmac and grass are open to the elements, and as a play area for 3 to 5 year olds is not very exciting.
Professor! Helicopter! Some flowers.
Ours is a difficult area in which to organise fundraising activities. We have tried. Is there any way you could help us, please? I looked into ways of raising some funds to buy some equipment. 2 consultants came along, and in discussion with them and in discussion with children and parents and staff, we came up with a number of options. One of the consultants suggested that if I was prepared to write around and see if I could get support from local industries, shops, garden centres, then maybe I could generate some interest.